Hello and welcome. My name is Namara Alex Mike, physiotherapy student. Today I'm going to explain about pathogenesis and diagnosis of rheumatoid arthritis. So first of all, let us understand what is rheumatoid arthritis. Rheumatoid arthritis, it is a chronic inflammatory multi-system disorder which mainly affects the joints, but it can affect other places like nervous system, cardiovascular system, and others. So let us go directly on the pathogenesis. But for better understanding, let us see this flow chart. So the pathogenesis of rheumatoid arthritis, it starts with individuals who are genetically susceptible. Then these are the individuals who are carrying human leukocytes antigen DR1 and DR4. Then these people, after getting to the environment that will be triggering the pathogenesis of the disease, which will be a presence of infection, sex hormones, things like smoking, they'll be leading to activation of the CD4 cells and T cells. These CD4 and T cells are going to release the cytokines. The cytokines released will be tumor necrotic factor alpha, interferon, gamma, and interleukin 1. Then after activation of, after release of these cytokines are going to activate the following: the B cells, endothelial cells, and macrophages. Then, after these B cells and endothelial cells and macrophages are activated, they're going to perform the following as accordingly. The B cells are going to release anti-IgG, which is also referred as a rheumatoid factor. Then endothelial cells are going to lead to adhesion of molecules, and macrophages are going to lead to cytokine and protease release. So more cytokines are going to release here by macrophages effect. Then all of these effects are going to aggregate and lead to inflammation of the cells and immune complex and mainly Pannas formation, which is the characteristic feature in pathogenesis of rheumatoid arthritis. Then after this effect, there will be damage of synovium, cartilage, and small blood vessels here. This damage of these soft tissues are going to lead to cartilage, bone destruction, fibrosis, and later ankylosis, and uh, lead to the effect which is joint deformities. So after that, let us see on the diagnosis of rheumatoid arthritis. First of all, it is by measurement of rheumatoid factor, which is present in more than 80% of the cases. The normal range is 40 to 60 units per microliter. Again, there is a, detection or presence of HLA, DR1 and 4, which will be for the genetic susceptible individuals. Then again, we have radiological findings where there will be narrowing of the joint space, and also there will be the wrist will be radial deviated and arm deviation of the fingers. Other factors for indication of inflammation, they can be also used like elevated ESR, which is more than 30 millimeter per hour. Then elevated C-reactive protein, which can be more than 3 milligrams per milliliter, per liter, sorry. Also, we can indicate by presence of normochromic, normocytic anemia. And again, if there is elevation of anticyclic citrulline peptide antibodies. So that is all for diagnosis of rheumatoid arthritis. Thank you.